So Dr. Namita Caen, thank you for being interviewed by us at Flexible Films. I'd like to ask you first, what brings you back to the UK?
Well, actually, I am working with a couple who have booked a bespoke week-long retreat. So I'll be working with them in their home for a week on the specific issues and goals that they would like some help with.
So does this mean that you work internationally and people can contact you for a bespoke service like this?
Yes, absolutely. I'm currently living in the San Francisco Bay Area, and my practice is based in Mill Valley, which is just close to the Golden Gate Bridge. But I travel wherever people need me. So I've been to Europe and I've traveled throughout the States, and it's just fun being able to reach people in different places.
And how long have you been practicing, and what brought you to this line of work?
Well, I've been practicing for almost 20 years now. And honestly, it was my own insecurities and lack of information and lack of experience around sexuality, and also my body image. I had very negative body image, and I was curious about how I could improve and empower myself to feel better about my body, to feel better in my skin, and to have more knowledge, acceptance, and experience around my sexuality.
And what was the training, and how long did it take, and what did you have to do?
Sure. Well, it took many years, and I took many workshops and classes on sexuality, and that was mostly to improve my own relationship with my sexuality. And during the course of that, I became a life coach. And then I decided that what I really wanted to coach people on was not so much things like career changes, but more about relationship and sexuality. So I went to school, and I earned a doctorate in human sexuality. I also took various different classes in coaching, specifically around relationships and sexuality. So I'm certified as a sex and intimacy coach. I have a doctorate in human sexuality, and then I have various other certifications that pertain to advanced courses in sexuality.
And I know you're from England. What would you say are some of the differences between England and America in terms of sexuality and talking about sexuality?
That's a really good question, and a hard one for me to answer because I've been gone for so long. But I would say that on the whole, I find both England and America to be somewhat inhibited and repressed when it comes to sexuality compared to, let's say, other European countries like Norway, Sweden, Denmark, Holland, where sexual education is much more advanced and much more available. So in a way, I find England and America to be somewhat similar when it comes to their relationship to sexuality.
And what would you say are the benefits of someone coming to seek help from you?
Well, first of all, you could expect to be able to have a very frank, non-judgmental conversation with me around sexuality and around some of the issues that you might possibly be having if you had any, so that the conversation around sex would be normalized and validated. It's no longer this taboo subject that we talk about in secret, or we don't talk about at all, or that we're afraid to talk about because somehow we're naturally supposed to know what to do, and we're naturally supposed to be able to find ways to make sex satisfying in our relationships. So first of all, just a frank, honest conversation, and then a deeper look at some of the issues that you might be struggling with if you had issues. And then we would see how we could resolve those issues, whether they were just about you or about you and your partner, so that you can move towards having a more satisfying sexual connection to yourself and to your partner.
And would it be just talking, or would there be any physical exercises, or I know everyone's different, but...
Well, the kind of work that I do is a little bit different from regular straight sex therapy that tends to be a bit more just talking and is a little more similar to regular therapy. So coaching is very goal oriented. So we're working towards you achieving the goals and being able to accomplish the desires that you have for yourself. So my sessions are slightly longer than regular therapy. They're 75 minutes. Regular therapy is typically 50, maybe 55 minutes. And I include exercises, fully clothed, non-sexual exercises in the room so that couples can begin to have a sense of the exercises that I want them to practice at home. And then I give every individual or couple home play exercises that they can practice alone and with their partner. So there's a momentum that's being created in between sessions, much in the same way that if you were coming to learn Spanish and you never practiced, there's going to be very little progress in between sessions. And if you're practicing in between, you've already come to a different place, and we're sort of, in a way, having building blocks towards you accomplishing your goals.
Can you give me some examples of some of the sort of struggles and challenges people have had, and some of the successes also that you've encountered in your practice?
Yes, absolutely. So some really common issues or concerns that people would call me with are being in a sexless marriage or a marriage with very little sexual activity, one of the two partners losing interest in sex altogether, somebody thinking that they're possibly asexual and have no interest whatsoever in sex, somebody who's experiencing some physical changes, so that might be erectile dysfunction, it may be early or delayed ejaculation for men. For women, it might be painful sex, such as vaginismus, or struggling with menopausal changes where they just feel different and the hormonal fluctuation is causing them to lose connection with their body and even with the idea of having desire around sex. A very common one is just inability to communicate in a kind, loving, and caring way around the topic of sexuality. And then you asked about success stories. So when we start to look at what is happening currently, rather than trying to recreate, and it's such a cliche, that lost spark from the honeymoon phase, for example. Well, the honeymoon phase is gone. It was wonderful when it was there, but 20 years later, we're no longer in that phase. And so it's important to be able to accommodate and acclimate to what is happening now. Who are we today as sexual beings? And what works for us now? What brings us pleasure? What do we find enjoyable? Have our sexual interests diminished or grown over time? Do we find ourselves interested in other things? So I think if we can start to focus on what's happening in present time and let go of this idea that we lost something in the past and that we need to recreate it to have a great sex life, when in fact it is in the past, and focus on the present and the future, I think that's where sex becomes interesting and it becomes something that evolves over time.
And how long, on average, I know it's all different, but on average, would people come to see you?
As you said, that's going to vary from one client to the next, depending on why they've come to see me, and also if they're doing their home play assignments. So I would say that someone who comes in and is really valuing both the time and the money that they're investing in themselves, somewhere between 5 and 10 sessions, it could be 15. And somebody who doesn't do the home play or cancels their appointments or is very sporadic about coming in often because they start to feel confronted by what they're looking at, which is understandable, and that also happens in regular therapy. In that case, it's going to take longer.
Thank you. What sort of satisfaction do you get from doing this work, if any?
Well, I get lots of satisfaction. I have to say that the study of human sexuality and sexuality in general actually is a passion of mine. So I'm curious about, what drives and motivates us to feel pleasure, why is this person attracted to that person, and what sexual interests might they have, and people who, for example, have fetishes. I'm fascinated by why they might be into the things that they're into. Be they very common things that lots of people are into, or be it something very unique and very different that's very unusual. So I just find it to be an absolutely fascinating part of the human experience.
And in your view, I know what you're likely to say, but do you think sex is an important part of life, or can we do without it?
Well, I can only speak for myself and the many, many clients that I've seen. So I'm not going to generalize about everybody, because there are some people who genuinely consider themselves to be asexual and who have no interest in sex, never have, and say that they never will. So perhaps those are a small minority of people for whom genuinely sex is of no interest whatsoever. For the rest of us, I do feel that it's a vital and healthy part of human relationship, and that it is the most physically intimate way of connecting with another person, and also the most physically intimate way of connecting with oneself. So for me, it's vital. It's at the very core of what it is to be a human being and to enjoy pleasure, because our bodies are made to be able to experience and enjoy pleasure.
And how do you work with people? Do you work people individually as a couple, or how does it? Who are your client groups?
Well, I work with pretty much anybody, really. So anybody who's seeking help in this area. So that's going to be individual men, individual women, couples, and then within the gender, I also see people who consider themselves to be trans. I see people of every kind of possible sexual orientation. I have lots of lesbian clients and gay clients, and it's really anybody who would like help, including people with disability. So it's very important for me that sexuality be something that is completely inclusive, and that we include all the diverse populations.
And my final question is, if I was interested in your service but I don't live in America, would you be able to accommodate that?
Yes, absolutely. So I have people who live in areas where there just isn't anybody that they could go and see physically. And then I see people who just for some reason feel like they have a great connection with me, but they're not local. So I work via Skype, I work via FaceTime, and I also work on the phone and via email.
Brilliant. I'm now finished with my questions. You've answered them beautifully. But is there anything else that you'd like to say about your job and your experience?
Well, I would like to say, in closing, that I want to encourage people to step out of their comfort zone. And if sexuality or your relationship to your body or your relationship with your partner is something that you have concerns around, I want to encourage people to seek help in that area.
And what sort of things have you learnt the most in this line of work for yourself?
I think what I've learned the most is just that there is such an infinite variety of interests, infinite variety of body shapes, infinite variety of the way that our bodies are constructed, the way that we experience pleasure. And so one of the questions I get so much is, am I normal? And I really want to encourage people to just cross out that question altogether. There is no normal. What's normal is you being you and experiencing the pleasure that your body is capable of experiencing, and connecting with your partner in whatever way feels right for the two of you. It does not matter what anybody else is doing. It only matters what works for you.
That's a nice way to end. Thank you very much for your time.
You're so welcome. Thank you for having me.